you, John. We continue with the three presentations and start with a paper called Prevalence of Groin Injuries and Association, a prospective study of acute groin injury diagnosis in 110 athletes. And the presenter is Andreas Serner, who is a postgraduate researcher here in Qatar. Welcome, Andreas.
Thank you very much. So thank you very much for coming, everyone, and thank you especially to Qatar for having me as part of the team, part of the Sports Groin Pain Center, which is truly an exciting experience. We have a lot of good stuff going on here that you will hear more about later, and I'm really excited to present some of the first stuff that I'm doing in my PhD. I'm a physiotherapist, and I'm doing a PhD at the moment where we're looking at acute groin injuries only. And this is some of the diagnoses that we have in the hospital of the athletes coming in. So we already have, for the past 2 seasons, 110 athletes. But let me go a little bit closer. So as we heard earlier in the session, that the groin injuries are very, very common, especially in football. But a lot of the times, the acute groin injuries are not included or separated in these overviews. So it's very basic what we know about acute groin injuries if we look at the literature. So for this first study, we aim to get a little bit more information on the injury mechanism and also to report the clinical and radiological diagnosis. All right, so what we did, we had 110 male athletes from various sports, and we had them all prospectively. So we took up the project from the beginning. The players come in from all over the country, come in within 7 days of injury onset. We do a standardized clinical examination in the outpatient department, and we do an ultrasound and an MRI. It's a varied types of sports that come in, but the majority of football players. We can see a lot of futsal players here as well. Futsal is a big sport here compared to other places in Europe, so very, very interesting to see that it's similar to the regular football. With football here, it's soccer, so a lot of soccer players. But we also have quite a few basketball and handball players included in this study. So if we look at the general diagnosis, we can see that the most common injury is the adductors, and that doesn't matter whether we do a clinical definition, where we use, where the sports medicine physician diagnoses the injury based on his clinical findings of palpation, resistance pains, etc., whether we use the MRI or we use the ultrasound. When we go into the MRI and the ultrasound, we can see that a lot of the imaging is negative, but the distribution in total remains the same. If we go a little bit further into the diagnosis of the adductor injuries, we can see that in most cases, when we look at the imaging reports, we can see that the adductor longus is involved in about 9 out of 10 cases. So that kind of solidifies the fact that the adductor, or the concept that adductor longus is one of the most important muscles in the adductor group. Second and third are the iliopsoas and rectus femoris injuries, which are also very frequent, and less so for the abdominal and sartorius injuries. We can see that in MRI and ultrasound, there are a bit fewer injuries in the radiology than there are in the clinical diagnosis, so that it's probably because we give more diagnosis in the clinical examination. But if we look at it on an individual point of view, we can see that our clinical diagnosis does not always match our radiological findings. When we diagnose an adductor injury, it's rare that we don't have an adductor injury, but an adductor or an injury in another location. Whereas if we diagnose an iliopsoas or a rectus femoris injury, both in the MRI and the ultrasound, there's no injury to the iliopsoas or rectus femoris, but injury to another muscle. And we go a little bit closer to the injury mechanism. We ask the players how did the injury occur. We have kicking as the main injury mechanism. We have change of direction as the second. And if we divide it into the football codes and other sports, we can see that in football, 40% of the injuries are from kicking. And in other sports, it's mainly change of direction. So what we can take home from this first part of the study is that the injuries occur mainly during kicking and change of direction. The majority of the injuries are adductor injuries, with 9 out of 10 being in the adductor longus. A fourth of these acute groin injuries are imaging negative. And in general, there can be a discrepancy between the clinical examination and the imaging, especially for the iliopsoas and rectus femoris diagnosis. So this is part of the beginning of the study, but we can still say, all right, what do we want to use this for? We can use it for load monitoring. If we have the injury mechanisms, we can look at how much kicking and change of directions are involved in the training and in the game, and try to adjust that. If we want to do prevention programs, maybe we should be more specific to the adductor group. If we have a player with an injury, we can be pretty confident in our adductor diagnosis. Whereas if we have some uncertainties, we should consider imaging, especially for injuries around the iliopsoas and rectus femoris area. And with this project, we're continuing on and looking at how long it takes for the players to get back to their sport. So we hopefully know some more about the findings, the more specific findings in the initial examinations and the relevance of that. Thank you.